In terms of long-term protocols, I think that a large part of it was that we changed the way, I mean, for example, we don't really have basements in New Orleans because we flood, but we do have first floors. And I think that foolishly, some of the larger hospital systems placed a lot of generators on their first floors, or on the mezzanines. And these were areas that flooded. Don't put your heavy machinery in areas that flood. I think that was a very, very important lesson. And so you are seeing, since Katrina, you have seen the shifting of these generators to higher floors, so areas that are least likely to flood. I think in terms of physician and healthcare readiness, I think keeping teams on board. That didn't happen for Katrina. I mean, there was some form of teams that were done. They're better established at this point. We actually come to the hospital. I personally come to the hospital with 3 to 5 days of provisions on my own that I can sustain myself on. It's the same with change of clothes, just anything that I know that I will need for at least 3 to 5 days, assuming that another Katrina happens. I think it would be unwise to not assume another Katrina could happen. They talk about these once in 100-year storms that seem to be happening twice or three times a year. So not assuming something like Katrina could happen again would be unwise. We had a very, very large hurricane about exactly 17 years to the date of Katrina. It was August 29th. I don't even, time has eluded me now. I think it was 2022 or 2021 was Hurricane Ida, and it was right in the middle of the Delta pandemic, which was the deadliest pandemic that we had. And in fact, to myself, I would just refer to it as COVID. It's just the combination of both Delta, COVID, and Hurricane Ida. That I refer to that as a dry Katrina. We fortunately did not have the deaths that we saw with COVID with Katrina. Certainly not the flooding, but a one of the towers that supplies power downstream to the entirety of New Orleans actually just slipped and fell right into the river. I mean, it like whatever ground it was on had just disintegrated underneath this tower, and it just literally fell into the Mississippi, and it completely knocked out the entirety of power for New Orleans for several weeks. It was in the middle of summer. It was brutally, brutally hot. And I would say for about 5 to 7 days, there was no power in the city. And then power kind of slowly came back on. And so I think preparing yourself for issues regarding not having power, I think is very important. I think a lot of people have since have obtained small generators, ourselves included, that can at least power a little air conditioner, power your refrigerator, not power the entirety of your house, but small portions of it, so that we can remain at least comfortable and cool. Certainly, the hospitals that I work at did fine during Ida. Obviously, they never lost power, and if they did, it was a brief moment of power. So, air conditioning, internet, hot coffee, really, quite frankly, in the morning was important. You would surprise yourself with the things that you actually want in the morning when you're, even if it's hot outside, just having a cup of coffee. The ritual of making a cup of coffee is important. And, these little generators and keeping cool will prevent a husband and wife from exchanging little candles that say sorry for the things that I said to you while we didn't have power. Because that did happen between my wife and I. So, in all seriousness, I think we're better prepared in terms of mentally going through it. I think people are better prepared with leaving. We saw that in Florida. We saw that there was a large exodus out of the state as the hurricane was coming in. But I think what's important for us to talk about, and we could talk about this later, is that these hurricanes, as they happen more frequently, are going to disproportionately affect people who are on the lower end of the socioeconomic scale, people who are marginalized, because, as we know from studies, that Americans don't have $400 as a reserve for an emergency. And if these happen regularly, where you're going to have to pay for gasoline to get out, you're going to have to pay for hotels, you're not going to be able to work, your job is being interrupted, this has significant financial impacts as well. So I think that that is something that's important for planners to consider as well moving forward. But I think we've done better. I think we're certainly more prepared as a result of Katrina. And I certainly hope that people are able to learn from the lessons that we learned.